Now, as we commemorate World Malaria Day today, malaria remains a major public health threat. The UN World Health Organization has called for accelerating scaled-up efforts to prevent the deadly disease. Statistics from the United Nations Health Agency indicate that approximately 429,000 people died of malaria in 2015, the majority of them young children in Africa. The World Health Organization's African Regional Director, Matshidiso Moeti, says the world's first malaria vaccine, the RTSS, has the potential to save thousands of lives. The vaccine will be launched in pilot phases in Kenya, Ghana and Malawi from the beginning of next year.
African governments are eagerly waiting for this additional tool, I would say. And the 3 countries that were selected for this pilot program were very interested in trying out this tool, because we know, if you can prevent severe malaria, if you can prevent episodes of malaria, this is huge in terms of a contribution to the toolkit that we have for malaria in general. So countries are key.
As a person who has worked on the continent for a long time, maybe in the health sector, you could tell us just how big is the burden of malaria in Africa, and especially sub-Saharan Africa?
So overall, the number of deaths from malaria each year is about 240,000, and I think 90% plus of those are in the African region. So the mortality of malaria is mainly in Africa, for example. So the burden is heavy here, and we are the continent that has to make the most progress in terms of making a difference on the continent and globally.
And finally, away from malaria, the African Union is in the process of setting up a CDC, something close to what the Americans have. How do you think this will help in the fight against disease burdens in the continent?
Yes, I think it's a good thing, and it's an expression of the political commitment of African governments to addressing outbreaks and epidemics.